Did you know injuries result in nearly 40 million ER visits per year? I'm talking about things like cuts, concussions, burns, and broken bones. And with numbers like that, I thought it was time we brushed up on our basic first aid skills. Welcome to Ask Dr. Manning. A well-stocked first aid kit is not only handy to have around, it can absolutely save your life. But when situations become too serious to deal with at home, it's time to head to your local emergency room. We checked out the ER department at Roosevelt Hospital here in Midtown Manhattan to see what really goes on once you enter those sliding glass doors. Screaming ambulance sirens have become an all too familiar sound for Dr. Gabe Wilson. He's been an attending ER doctor for nearly a decade in the heart of New York City.
Sometimes literally I can be handed 3 EKGs at once. I'm on 2 phone lines and I have over a page for another phone call, and then I need to run in to see a patient, so it can get crazy.
And there's no doubt about it. Emergency rooms can quickly become chaotic, especially with the sheer number of people who seek medical attention on a daily basis. The CDC says there are more than 119 million ER visits per year. To put that in perspective, that means an estimated 326,000 Americans flock to emergency rooms every day across the nation. A statistic that doesn't surprise Dr. Wilson one bit.
It's for a variety of problems, and one of the great things about emergency medicine in this country is we're always here for people. Most of the time people are really sick and they come in. Other times they don't have access to health care otherwise. It's nice to be there always for people, even if they don't have health insurance. It's nice.
And unlike those TV dramas that show emergency rooms packed with gunshot victims and people impaled with foreign objects, Dr. Wilson says a typical day for him usually involves patients with respiratory infections, pneumonia, and chest pains.
Need an EKG for the woman with chest pain in room 22?
Sure.
But that doesn't mean this job doesn't keep him on his toes.
Last year, I got called out to the sidewalk to deliver a baby in a taxi. We get to do a multitude of things, and it keeps the job interesting. And we meet so many different peoples from all ranges of society. It's exciting.
When we come back, find out how to tell the difference between an injury that requires an emergency room visit and one that can be handled at home. The information might surprise you. Although some wounds and injuries can be addressed at home, some cases are just too serious. And listen to me, this means you have to go to the emergency room to get help. But before you get to the hospital, there are things you can do to minimize your injuries. Here to explain is Dr. Jeff Raybridge, Medical Director of EMS and Disaster Preparedness at St. Luke's Roosevelt Hospital in New York City. Thank you for coming to the program. Let's go through a panoply of different things. First of all, how do you handle cuts and abrasions?
So most cuts and abrasions are minor wounds that can be properly handled at home. The first thing you want to do is you want to clean the wound out. So really you want to use just cold water, soap and water, wash the wound gently. And then you could put bacitracin or Neosporin, any type of antibiotic ointment.
And a little Band-Aid,
And a little
right?
Band-Aid.
Okay, but what happens if you have a lot of bleeding? How do you handle bleeding?
So if there's a lot of bleeding, you want to first stop the bleeding. And the best way to stop bleeding is with direct pressure. So you get something that's clean. Not everyone has gauze readily available. You could take a clean towel or a shirt, if that's all you have available, and apply pressure to the wound. And you want to hold firm pressure on the wound for several minutes to get the bleeding to stop. If you've applied pressure for 5-10 minutes and the bleeding isn't stopping, it's time to get help.
Okay, so the question always becomes then, when do you go to the emergency room when you have a cut? Because a lot of times they say, people say you need stitches, maybe you don't need stitches. How do you know you have to go to the emergency room?
That's the biggest question people have is, do I need stitches or not? And the best way to tell that is if there's continued bleeding that won't stop, or if you look at the wound and it looks more than just a small cut, you can see into the wound. The wound edges look like they're separated, that they're gaping, that there's a hole there.
Is there a length or a depth on the tissue that says, okay, you need a stitch?
Not particularly, but if it's through the skin, if it's into the structures below the skin, or it's particularly long, longer than an inch or so, then most of those will need stitches. But the best bet is, if you're not sure, is to have a professional look at it and let them tell, because there is a time limit.
Household accidents happen, so what should you do if you lose a finger or a toe?
So if you lose a finger or a toe, that's a serious medical emergency.
I would think.
And you need help with that. So the first thing you want to do is to call 911 or activate the EMS system and get assistance. After you do that, you want to apply pressure to whatever the wound is to stop the bleeding. And it's very important that the amputated part be brought with you to the hospital.
Should you put it on ice?
So people ask what's the best way to handle this. What you want to do is put it in a clean towel or gauze and put that in a plastic bag and then put that bag on ice. You never want to put the part directly in water or directly on ice, and never dry ice. Okay.
Let's talk about some falls. You break a bone, you see that it's broken, at least you feel it. But what can you do, what should you do before you have to go to the emergency room? And so far as, you realize you have a broken bone.
So you realize you have a broken bone, and most of the pain from a broken bone comes from those broken bone ends are now free to move, and they can rub against each other and cause pretty severe pain. So the best thing you can do is to immobilize the part. If you break your leg, your ankle, you don't want to walk on it. You want to stay where you are. You want to support it. So it means if you break your wrist, something as simple as wrapping a magazine around it with tape to stabilize the broken bone. And then apply ice. Ice will help reduce the swelling and prevent further swelling from developing, and then it's time to go get help. The other important thing is you should never, if you know you need to go to the emergency room, especially with a broken bone, you should never eat or drink anything before you go, because some of these broken bones may require an operation to fix.
All right. This is a very important question because, my kids play football in the backyard all the time. What are some of the warning signs for a concussion?
So warning signs for a concussion, things that would concern us is after you hit your head or get hit, if you're vomiting. And we're not talking about vomiting once, but you have persistent vomiting. You're throwing up 2 or 3 times. You're feeling very nauseous, severe headache, dizziness, any type of confusion. The person can't remember how they hurt their head or ask the same questions over and over again. Those are all signs of concussion or possibly an even more serious brain injury, and they should all be evaluated in the emergency department.
All right. This is, of course, more significant. What are the signs of a heart attack? Because, heart attacks are still the main things that happen at home many times in an emergency case.
Sure.
So what are the signs of a heart attack?
The most common sign that people get is they'll get chest pain. Unexplained trouble breathing, if there's any pain in the arm, particularly the left arm, or you feel very sweaty and nauseous with this as well. Those are all signs of a heart attack. And the bottom line is if you're having chest pain, you should go get checked out. It's very difficult to determine if it's a heart attack or not.
Sometimes people are very stubborn, especially men. But what's the time interval between, that you should have? If you're having chest pressures or, you feel funny or you have a little pain in the arm, as you mentioned before, how much time do I have before I get to
Well, it's interesting that most people in this country wait an average of over 2 hours before they seek help, and that's too long.
That's too long.
If you're having chest pains for 10, 15 minutes and it's not going away, it's time to see someone. We have excellent treatment therapy currently for heart attacks, but the key is to get to the hospital as quickly as possible.
And that's when you embolize the clot in the heart,
Absolutely.
Right?
We can go in
and take the clot out.
Right. We can go in, take the clot out. We can put a stent in. There's advanced treatments that can be done now that prevent further damage to the heart, but the key thing is to get there as quickly as possible.
Any other information that you think is necessary for people to have at home?
I think the most important thing people can have at home and to bring with them when they come to the hospital is a single piece of paper where they have their medications written down, what medicines they take, what are the dosages, the names and phone numbers of their doctor. And the other thing that's very helpful to us in the emergency department is if you've had an EKG in the past, get a copy of it from your doctor and bring that with you, especially if you're having chest pain. It can save a lot of time at the hospital.
Thank you so much. We learned a lot, and this is valuable information that I think is going to save a lot of people's life if they realize all the things like they can do to, get help at home. Coming up, what you must have in your first aid kit at home, plus
911, teacher emergency.
We go inside an ambulance to see what the pros carry every day to keep us all safe. Let's hope you never have to be in an ambulance, but if you do, you should know you're in the best possible hands. Between the expertise of the EMTs and paramedics and all that life-saving equipment, it's like a giant first aid kit on wheels. Take a look.
911, teacher emergency.
Minutes after calls like that come in, it's EMTs like Michael Benny and Pedro Echeverria who are dispatched to the scene. And even though they have a combined 30-plus years on the job, they would be scrambling if it wasn't for this well-stocked ambulance.
The first thing we do when we go on a call is we always bring our trauma bag. We have a defibrillator right here in case somebody's heart stops beating. And we have oxygen right here.
That's just the beginning. From trauma dressings to burn sheets and baby delivery kits, ambulances are packed with everything imaginable, inside and outside, to stabilize the patient until they reach the hospital.
And here we have different masks and tape and stuff. Over here, we have all different size blood pressure cuffs. We have triage tags if we go to a disaster. We have bandages, 5x9 splints in case somebody fractures an arm.
Unlike some predictable day jobs, Michael and Pedro know that absolutely anything can happen when their shift starts.
The calls are different every day. It could be a regular sick person, somebody that's been shot, stabbed, attempted suicide in the subway systems, delivering babies. You name it, it happens. Responding to that 545 or to the 5.
Believe me, it's the great work of EMTs and paramedics like Michael and Pedro who ultimately help ER doctors provide the best possible care to their patients. And as I said at the top of the show, a well-stocked first aid kit can be a real lifesaver too. The American Red Cross was kind enough to provide one of these so we could show you the essentials. Among the many things inside, you're going to find adhesive bandages, sterile dressings, antiseptic wipes, and instant cold compresses, scissors, and the list goes on and on and on. And whether you buy one from the Red Cross or your local drugstore, the key here is to prepare yourself for an emergency situation. For more information on the first aid kits and first aid care, go to redcross.com. And coming up, we all know that kids have a funny way of getting into mischief, and sometimes that leads to injury. So get ready for any situation next. So now you know what to do if you get hurt. But what about your child? Sure, a hug, a kiss can cure a lot. But for more serious injuries, we got a crash course from one mom who's also a doctor.
1, 2, 3, jump.
Tamara Kuitunen is not only a mom of 3-year-old twin girls and a very curious 21-month-old, she's also a doctor, which makes her a bit of an expert when it comes to first aid at home.
I think being prepared is really important. Having basic first aid things at home is really key. The Band-Aids, the thermometer, alcohol, and all in a centralized place.
The busy mom is able to keep everything in one place with the help of a well-stocked first aid kit. From gauze pads to allergy medication and Pedialyte strips, Tamara's prepared for all of life's little and big emergencies.
I have a couple of tips for parents with regard to you've safe-proofed your house. You did what the experts say, crawling around on your hands and knees and looking to see what they see and so that you don't get into things.
The scary fact about kids getting into everything is that they could ingest something. If that happens, call the National Poison Center at 1-800-POISONS. Tamara also suggests keeping activated charcoal in your medicine cabinet.
You drink it and it absorbs the medication that you've taken in your gut so it doesn't get released into the bloodstream, minimizing the impact of the ingestion.
Choking is another frightening scenario for parents.
What you can do immediately, in a high chair, I pull him out and do back thrust. So between the shoulder blades, you're going to hit with the palm of your hand behind his shoulder blades. And the idea of that is to try to expel whatever may be in the upper airway.
If that doesn't work, you can do this.
From the lower belly, you're going to push pressure and push up, just as you would with the Heimlich, but not quite with the same hand fist that you would with an adult.
And check the mouth to see if you can remove the food that is stuck. And if all else fails, call 911.
In general, I say partner with your physicians, and I think parents are really their children's best advocate. Always seek medical care if you're concerned.
We presented you with as many first aid skills as time allowed, and I hope at the very least you feel a little bit more comfortable facing an emergency. But there are many more skills that you should know, particularly if you care for a child or an elderly parent. The best way to be prepared is to take a first aid class. Check out your local Red Cross, police, fire, or EMT departments and ask when they are holding classes. The time and money it takes is well worth it. And until that class, remember to check out FoxNewsHealth.com for more on today's topic. That's all for now. Thank you so much for joining us. I'm Dr. Manny, and I'll see you next week.